Welcome. Hi everyone. We talk today about very important problem. Urinary problem. Neurogenical bladder is a dysfunction of the bladder due to congenital or acquired pathology of the nerve system. There are two types of pathology depending on the state of the detrusor. It is hyperreflexic and hyporeflexic syndrome. Relevance. Urination disorders have a social aspect, since they can limit the physical and mental activity of a person, create a problem with his social adaptation in a state. The urgent of the problem of dysfunction of the bladder is due not only to a violation of the quality of life, but also to the complications that lead to its neurogenical dysfunction. We have a lot of complications. For example, myofascial syndrome, pelvis venous congestion syndrome, development of secondary inflammatory dystrophic change in the urinary systems is observed. For example, vesical urinary reflux, chronic cystite, pyelonephritis, and ureterohydronephritis, leading of arterial hypertension, nephrosclerosis, and chronic renal failure, which can threaten early disability. The bladder is considered normal reflex in urination acute and normal bladder volume. In the case of detrusor hyperreflectivity, the volume of the bladder is less than normal and involuntary contraction occur. According to the recommendation of the ICS, our active bladder is divided into neurogenical and idiopathic. Neurogenical when the patient has a neurological pathology, and idiopathic when the cause is not clear. Next destruction, next pathology, when detrusor underactivity is defined as a decrease or absence of its contractile activity during the excretion phase and leading to impaired bladder emptying. So we talk about treatment. All therapeutic methods used for neurological bladder dysfunction can be divided into three main areas. And so, non-medication treatment, medication therapy, and surgery therapy. We talk about non-medical and medical treatment. The main principles is the beginning of therapeutical methods with the least traumatic technique, which gives the least number of side effects. Non-medical treatment. The advantage of non-medical treatment is the almost complete absence of side effect and restriction on subsequent treatment, as well as the possibility of combining with drug therapy. Non-medical therapy, for example, training of the bladder, which includes the observance by the patient of a pre-established plan of urination with a progressive increase in the interval between them. Conduction is set exercise for the pelvis muscle using the biofeedback method. Physiotherapy method, for example, electrical stimulation, laser, hyperbaric oxygen therapy, thermal procedure, diadynamic, current, amplipulse ultrasound, and another. Medical therapy. Current pharmacotherapy is one of the most common and effective treatment of neurological bladder dysfunction. This method is available. It can be used for a long time and it's possible to recover. Charge of pharmacotherapy can conditionally be divided into central and periphery. The central zones include the control of urination of the spinal cord and brain, while the peripheral ones include the bladder, urethra, peripheral nerves, and ganglia. Next therapy, very young, very modern therapy, it is botulinum toxin. Botulinum therapy has been introduced into practice, and the effectiveness of injection of the drug into the wall on the bladder or urethra in the treatment of overactive and neurogenical bladder has been demonstrated. As a result, elimination or elevation of the symptoms of the disease was observed. Given the almost complete absence of side effect, long term up to 6 months, clinical effect, the use of botulinum toxin seems to be quite promising in the treatment of hyperreflexia and persistent forms of bladder overactive, sphincter dyssynergy, bladder outlet obstruction, and another ill. Next therapy, very modern therapy, very young therapy, PRP therapy. The use of autistic platelet-rich plasma is a unique treatment for both overactive and hypoactive bladders. It is our research. Research this thing. We have two groups. Group 1, first group, have 15 patients who received treatment according to the EAV clinical guideline for the treatment of patients with neurogenical bladder, control group. And second group, group 2, have 15 patients treated with PRP therapy as an addition to basis therapy. It is main group. This group of patients with injection with blood serum saturated with platelets using a special technique. This set have a comparative characteristic of POOF skull questionnaires symptom scores in patient of the control and main group. It is control group, it is main group. We monitoring this patient throughout year. The methods of minimal invasive treatment of neurogenical bladder using PRP therapy is pathogenetically substantiated, allowing to increase the reservoir function of the bladder, reduce pain, reduce urgency, and increase the relapse-free period of the disease. The technique we developed for the administration of platelet rich plasma, PRP therapy, and the analysis of its use with monitoring of patient throughout the year made it possible to formulate indication for the use of the new technique.